Thank you very much, dear Ashraf Armia, and thank you for this wonderful session in regarding refractive surgery. So my theme is overview of supracore method in presbyopia treatment. Supracore is a new generation presbyopia treatment by Bausch & Lomb Teneo excimer laser. It's a one-step procedure to correct both refractive error and presbyopia. Mechanism of action: it creates 12 micron elevated bump in the central 3 mm zone of the cornea. This area is negative spherical aberrations increase the eye's depth of focus to +2 near addition. It's surrounded by an aspheric optimized mid-peripheral zone for the intermediate and distance vision you see in the picture. Now you see the central zone, which is for near, intermediate zone, and the zone for the distance with different colors. It's pupil-dependent procedure. During the accommodation, we know the pupil constricts and the eye sees through the central near additional zone. When looking for the far objects, the pupil will dilate and sees through the aspheric optimized mid-peripheral zone. This is how it works. Also, we know that more than 300% of light pass through the distance zone, through the the near zone coming for the reading, and the peripheral for the distance. If pupil is small, there will be more impact on the distance vision. This is the criteria for these patients. That means the refractive sphere equivalent should be to myopia from -2 to -5, for hyperopia from +1 to +3. Astigmatism should be less than 2. Minke reading, you see it. The flap diameter, angle kappa, optical zone, everything is shown. So how to start with supracore? A detailed anamnesis of patients is required: lifestyle, refraction and visual acuity, eye health history. The most important point are the expectations of the patients. Detailed patient information about the vision possibilities after supracore treatment. We have a special simulation test for distance and for near. Also, we have a special application. I'm not sure do we have time for this, but we have Apple Store application. It's very comfortable to explain patients how it will be after the surgery. The aim of the study is to evaluate the safety and effectiveness of supracore femtolasic for treatment hyperopic and myopic presbyopes. We choose uncorrected distance visual acuity, near visual acuity, mean manifest refractive spherical equivalent, pupil size, angle kappa, the age of patients around this age, and follow-up of 12 months. A randomized control study was performed. The patients were divided into two groups, group with hyperopia and myopia. Diagnostic and surgical treatment was done on the ACE platform by Bausch & Lomb Teneo excimer laser, and femto super LASIK with the supracore laser algorithm was done to all the patients from two groups. In 6 and 12 months after surgery, we evaluate mean manifest refractive sphere equivalent, binocular uncorrected visual acuity, and near uncorrected visual acuity. And the results in first group of patients with hyperopia, after 6 months follow-up, uncorrected distance visual acuity and near visual acuity was sorry, can you switch on my last two slides? At 0.9 and 0.4 respectively. After 12 months follow-up, uncorrected distance visual acuity was the same for far, and for near was 0.3. And for myopia, after 6 months follow-up, uncorrected distance visual acuity was 0.8, and for near number 7, and after 12-month follow-up was the same for far, and for near 0.7. You see the charts. This is the charts. And in conclusion, supracore excimer laser algorithm is safe and effective for the treatment of presbyopia. It provides similar good binocular outcomes for hyperops and for myopes. Thank you for your attention. Both eyes. Both eyes, yes. Yes. Good.
Thank you so much, doctor, for nice illustration, the supracore, and we hear about it long time ago. How is the results long term, like 5 years from the time of the procedure?
Thank you for the question. It's a very good question. According to the studies, we know that in long term, the results decrease, mainly for near. For far, it's fine, but for near, in time, we have problems with reading. In our studies, we know that it's around 3 till 5 years, good results. Then after 5 years, the results, for reading is not so good.
Is it because of the regression or the increasing of the lens dysfunction of presbyopia?
Again, according to the studies, it is because of the regression.
Plus the dysfunction of the lens.
Yes, this is also. Yeah.